Great. So I think we'll get started and we'll let people join. I'm sure people are grabbing a cup of tea and some biscuits to sit through the session. So welcome everybody to the Mental Health at Work Commitment webinar series. For those that have joined the other webinars, you'll now know who I am and you would have seen this backdrop many times. But I'll introduce myself again. My name is Faye McGuinness and I am the Head of Workplace Wellbeing Programmes. Messages here. Sorry, someone muted me there. I'm going to say that again. My name is Faye McGuinness and I'm the Head of Workplace Wellbeing Programmes at the charity Mind. And I have been running this webinar series with our wonderful partners, and those partners are CIPD, Business in the Community, This Is Me, and the City Mental Health Alliance. So this is number 5 of 6 webinars. And I'm really pleased to be running this with my wonderful colleague, Ewan, who is our product manager for the Mental Health at Work website. So I'm going to hand over to Ewan, who's going to run most of the session. But what I want to do is just start by setting the scene a little bit. Just a few housekeeping rules before we get started. We are recording today's session, so if you don't want to be on camera, then please do switch your camera off. But we're recording them so that we can put them onto the Mental Health at Work website so that they can be watched after today. And we're inviting people to put any questions into the chat function. So if you have any questions, please post them throughout the session. And at the end, we will have some question and answer time. So really keen to hear from you and answer any of the questions that you might have. So let's start with what the Mental Health at Work commitment is. So quite simply, the Mental Health at Work commitment is a series of 6 standards that we recommend all employers implement to improve the mental health and well-being of their staff. And by implementing these 6 standards, what we think you'll be able to do is to promote well-being for everybody, to tackle the causes of poor mental health in your workplace, and also to provide mental health support for anybody that's experiencing a mental health problem. So there are 6 standards, and within those standards, there's quite a lot. But what we're saying to employers is that you don't have to have done all of them when you sign up. This is, a journey. It's not a sprint. This is about helping you start that journey in terms of embedding a framework that can really improve the mental health and well-being of your staff. So the Mental Health at Work commitment is that starting point for you. And why do we need to have the Mental Health at Work commitment? Well, I'm just going to draw out some stats that we knew before COVID hit. So before COVID hit, we knew that 51% of people felt comfortable talking about mental health in the workplace. So that means that there was still a high percentage of people that were still not comfortable talking about their mental health at work. And we know that for people who said that their mental health was poor at work, 39% of those said it was because work was the factor and the driver of that poor mental health. And we also knew that the cost of poor mental health at work before coronavirus hit was £45 billion every year to employers. And £29 billion of that was made up of presenteeism. So people in the workplace not feeling at their best, not being as productive as they could be because they weren't feeling well or weren't being in a culture where their mental health was prioritised. So before COVID hit, I think it's fair to say that we were already facing a crisis in terms of workplace mental health. But fast forward into the last 6 months, and actually the stats that I just shared with you have been revisited quite recently. And what the new stats have told us is that 56% of people now feel comfortable speaking about their mental health at work. So that has increased over the past 6 months by 5%, which is a really positive picture. And the number of people that have said that work is the driver of their poor mental health has gone up by 59% to 41%. Now, that is an increase, but actually we would have expected that to be a much bigger increase if employers hadn't prioritised mental health during the last 6 months. And actually the reality is that we've seen that they have. So we believe that COVID actually really does provide an opportunity for employers to really think about how they create mentally healthy workplaces for better mental health. So the idea of these webinars is to really dig deep into each of the standards and provide you with the practical tools and hints and tips that you need to implement them as you go forward. So just a reminder, today's webinar is looking at Standard 5, which is all about how you provide mental health tools and support. And it covers 3 areas. So it's about making sure that staff are aware of resources and tools available. It's about providing tailored in-house support and signposting. And it's about providing targeted help for particular issues. So financial well-being, domestic abuse, things that we know are impacting people in the workplace. So that's my quick introduction, but I'm now going to hand over to Ewan, who's going to take you through the standard in more detail and provide those practical hints and tips.
Hi there. So yes, my name's Ewan. I've met many of you in the question and answer of the previous, some of the previous sessions, but today I get to be the bride. So nice to meet you. As Faye said, I manage our Mental Health at Work website, which I'm going to show you a lot more about in another few minutes. But briefly, it's about collecting together advice, information, tools and resources from all sorts of providers into the same place. So I should say straight away, this session is not going to be just a whole list of types of tools and support you can offer. I don't think it's a good use of your time to just list things, and it's probably not the most useful way of sharing that information anyway. But what I certainly will be doing is mentioning quite a few things as we go along. All the way through, you'll see ideas, and that all of those will be linked to from the website at the end, so you'll be able to go back and dive into them yourself. And more importantly, I think, the things that I would like to do really, I'll talk a little bit about the bigger picture around providing mental health tools and support, the purpose, but also some of the ethics and issues around it. I'd like to talk through some practical points on providing mental health support, and that will be specifically based on 3 different experts who have contributed to our site recently, because as I said, we're more about bringing in everybody's expertise into the same place. Going to dive into a few examples of specific tools and resources that we would recommend, a mixture of things employees can use themselves and that others can use to support those employees more effectively. And as with the other webinars, we also have some on-the-ground experience from 2 different people. But first of all, a few overall thoughts really about this subject. It's easy to think of it as quite a dry one, maybe the least strategic, the least thoughtful of them, but actually it raises some interesting questions. And the first one, I think, is whose job is it to support an employee's mental health? There's an issue here about responsibility and power. Does providing tools to individuals imply that it's their responsibility to keep themselves well? Does that deny the influence that an employer might have as part of the problem or part of the solution? And actually, does the whole concept of providing these tools, providing things like resilience apps and so on, does that detract from sort of systemic issues that might be at fault that are causing problems for people? It's a reasonable question to think about, and it is one that we agonized over a while in deciding how to position our website in the first place. There are legal duties under health and safety legislation. Employers must minimize stress, and employers of above a certain number of employees must do a risk assessment of that. And in terms of disability, under the Equality Act, certain mental health conditions count as a disability, and so they're a protected characteristic. And that's not to say anything of just a sort of moral sense of that we should look after our employees. But also, sort of larger than that, there are the issues of power narratives in society overall, the less powerful, the vulnerable, the marginalized, just the lower paid. It's really important to be careful not to make a society's ills the fault of those who suffer most due to them. So the question then is, how do we respond to that tension? I think it's worth thinking about the different responsibilities as part of a whole. There might be reasonable parts that each participant can play. So tools themselves might be more on the individual side of things. Support might be more on the manager or human resources side of things. And many of the other standards we've looked at in this webinar series and in the commitment get more towards the company owner or senior director side of things. That does, of course, still leave the larger issue of society itself and of those who hold the power. Now, my wife is a researcher in poverty and well-being, and her answer to questions like this is always very clear. I'm coming to think there might be something to that, but it's probably a little larger than something we can address in this forum, so I'll move on from it. But actually, I do want to try and resolve it a bit by just going straight in by sharing with you a couple of frameworks from people we've worked with that try to resolve the tension a little bit by emphasizing that there's a part to play for everybody. I won't go through them in detail because they're really they're extremely accessibly written, and you can find them easily in the links afterwards. But briefly, one of them, the ACAS framework for positive mental health at work. Now, this is about working towards a shared goal of positive well-being and productive workplaces. And this positions as 3 sets of aims, really. Employers are visibly committed to positive mental health. Individuals are self-aware and ask for help when they need it. And managers are informed and open to conversations with their staff. So there's no tension, there's no sense of anybody being against each other. They're just different parts of a puzzle. And a similar one is this, the IGLOO framework from researchers at Sheffield University, Birkbeck, and Affinity Health at Work. And it takes a similar sort of approach. It's based on research into what helps people who are returning to work following mental ill health. And they focus on the role of the individual, the group of colleagues around them, the leaders, and the organisation, and all of these coming together to build someone's supportive igloo. So there are ways to think about this where we all have a part to play. It's also worth remembering that providing tools to people is a really good way of normalising the concept of mental health. It can be a less stigmatising way in for them. Effectively, it doesn't involve necessarily talking about things in such a medicalised way or feeling like an intervention if you're just simply sharing something that might be useful. Actually, on that note, I think probably the rise in apps destigmatizing things like mindfulness, meditation, even stress reduction techniques has been really helpful in that regard. It's also worth remembering that providing tools like self-directed training courses can be a really helpful way of empowering managers and colleagues to have more supportive conversations. This is a thing that Robin Vernon Harcourt mentioned specifically about a training course that I'll show you again in a few minutes. So tools and behaviours can be very much two sides of the same coin. Providing support, though, can sound as though it's about crisis intervention. It sometimes sounds as though that's what happen when things go wrong, but I think it's better seen as an ongoing pattern of interaction about establishing a protective atmosphere. We'll talk more about that shortly. But as a final sort of opening point, really, I just wanted to mention that much of this field could do with a look at through a lens of diversity. So a reminder to think about less powerful groups and who might be more affected than others by the current situations we're going through. On that note, though, we've got two different guests we're going to talk to today, and I'd like to bring in the first one now. So this is Michael. Now, I recorded this conversation last week because he's a collections driver for Royal Mail here in York. So as we all sit here in front of our computers, he is at this moment out and about working for us. It's grey and rainy outside here in York, in one of the regions where the virus increase is the most drastic. So I think perhaps especially because of the quite separate work that's been going on, that we've been involved in as well, to support people who we describe as frontline workers. If we're not careful, we can run the risk of thinking of us as two quite separate populations. So to avoid that, I wanted to bring in the voice of somebody right now who isn't a senior leader or HR or wellbeing specialist, just an individual working out and about who has an interest in mental health. You might think of him as a proxy for your own employees, or at least somebody who brings that voice into the discussion right at the beginning. Before I press play, though, I must apologise. When we recorded this last week, on playing it back, the sound quality was really quite poor. I think there was some noise reduction things going on his phone. So I've ended up editing out quite a lot of it. That's why you're going to see jumps to and fro. The parts that I've left, we tested them with a couple of people. You might miss the occasional word, but we're pretty confident you'll get the gist. It's about 6 minutes long. So yeah, hope you enjoy it. Michael, thank you. I've told everybody a bit about who you are, but really I thought it's 12:10 on a Friday afternoon. Well, it will be when everyone's watching this conversation. You and I are speaking a week before when you happen to be off work. What do you think, what's life like for you out there right now? What are you probably doing?
Life right now is pretty crazy work-wise. It's been like Christmas every day at Royal Mail. Obviously, a lot of people start home. There's a lot more people start ordering things that they need, things that they want, and it's just been relentless work-wise. It's a good thing in terms of business, but usually we only get this once a year. Now it's been 6 months of the year, and we're coming up to Christmas. It's still be fun. But yeah, it's in a way nothing's changed for me, and yet everything has changed because I'm still going to work. I'm still doing the same hours. I'm still going to the same places. But workload has increased, and my wife works at home, and we have an office in the garden, and everything changed for her. So I've sort of seen both sides just within my household.
And you've got childcare at home as well, haven't you?
Yes, I've got my son. He goes to like playground 3 days a week, so we're doing that, and we've got another one on the way now, lockdown baby. So,
congratulations.
We've got childcare, but we manage our way around that. We've got parents are in a bubble, and yeah, like I say, we've got playgroups, so we've sort of worked our way around that the best we can.
Wow, what a year you're having. So yeah, we're talking about how employers can support mental health today. I asked you to get involved because I know that you've got a bit of an interest in this. Do you want to tell us a bit about your story and sort of why you've ended up connected a bit?
A few years back now, I ended up going to my GP. Actually, of all places, I read an article on social media about anxiety. It was, as I was reading it, everything ticked boxes. I was diagnosed with anxiety. I was put on medication, but I wasn't happy with that. Sorry, that's my family. Someone here. I wasn't happy with that. Just being put on medication and sent on your way again. Not that that's the GP's fault. This is what they do. They obviously give me some advice. So I started looking into CBT, cognitive behaviour therapy, reading all about that. And yeah, I mean, learning about it is one of the best things I did. I think that is equal, if not more, than taking medication. What helps me is knowing how to deal with things.
We're talking about how what employers can do to support their employees. And this standard in particular is about providing mental health support and tools, making sure employees know what's available. I just wondered really, what's been helpful for you from what do you think is useful for people in positions like you from an employer?
My personal situation, having someone who's approachable, so you can sort of put them in the picture. They can only help you if they know how to help. But I mean, say for my manager, for instance, is approachable. He's not for 1 minute saying, I'm here, I'm a counsellor, I'm an expert. He's none of them things. But I think he's open to listening, and then we both work together. There's so many different tiers of managers in our workplace. I can only really speak about the one above me. I don't know above him how they can do it. But I think being approachable, whether you understand or not, the best way for me personally, I think, for them to learn is to speak to people who are seeking their help.
Sounds as though it's actually pretty simple in a way. It sounds not that complicated what you have to do in order to make quite a difference to people.
Definitely, yeah. I mean, say just for my manager, for instance, it could be overlooking 50 people at any time. It's tricky for him to be looking out for certain patterns in someone. You know, are they having a bad day? It's tricky for them. But if you give them that, if you work with them, and they are, they are willing to. So, for example, I've had I've been there 15 years now. I've had two proper managers who all looked up to me. The one before, he had targets to hit, and that was his only focus. If he didn't hit them targets, the people above came down on him. He didn't have time to sit down with me and talk through, what was going on with me. But for me, it was, if you've got your workforce all working to their potential, and that means looking after them mentally, you will hit them targets. The sort of he was missing out on one thing to do another. He could have got the best out of me if he knew my situation. So I think, just being approachable. I don't think, they don't necessarily need to go on courses to learn about all this. It's just listening to one person and you two working together. And if you do it on an individual basis, I think the panic is maybe sometimes that they have to do this blanket. Oh, well, I look after 50 people. I need to look, I need to look after all their mental health in this certain way. And I don't think it's like that. I think just these individual 5-minute sit downs can make a massive difference. And again, like you say, it sounds so simple.
Well, it's hugely helpful. Thank you. And what you don't know is I've got a whole load of more suggestions I'm about to share with everybody else to help them do that. So thank you so much. And thanks, as one of the customers who's been ordering Amazon things all year and so on. Thank you for thanks for supporting us all.
It was you, was it?
So thanks. And now one of the things I must give Michael his dues. One of the things I had to cut out just because of the sound quality is he talked for quite some time about how he actually ended up becoming quite a fundraiser and campaigner for mental health causes. And one of them is through this, Patch Amnesty. He collects donations of old heavy metal music patches and sells them at metal festivals in aid of Mind. He's raised over £15,000 in just over a year. So yeah, I didn't want to let that go past without telling you. We'll move on to providing support, and in particular, providing a supportive atmosphere. So I mentioned earlier that it can sound a little as though support is about crisis intervention, but I think it's more usefully seen mostly as an ongoing pattern of interaction, a protective atmosphere that underlies part of how a team operates. And one reason why I think we should think of it that way is that much of the support that can be really helpful is around the ups and downs of life, external factors or different vulnerabilities, rather than specific diagnoses. And secondly, if you do have that kind of atmosphere in place, it enables other parts to kick in more smoothly should they be necessary, from signposting to EAPs to reasonable adjustments or occupational health, to sickness absence, return to work, phased return, to policies such as mental health days or a culture among colleagues that enables others to help or pick up temporary slack. These are all things covered under other parts of the commitment. And in other webinars this couple of weeks, they're about strategy and culture and policy. But the gatekeeper to somebody accessing any of it, to any of it kicking in, is a more constant, lower level supportive culture. It really comes back to what Michael was saying there about just small, simple things making all the difference. One of the most helpful things might indeed be a 5-minute sit down with somebody who understands. So I want to focus on 3 aspects of providing support. And as I said, each of these is based on particular things we worked on with experts who have contributed to mental health at work recently. I'd like to start with this that we produced with Katie, our Organisational Development Officer. And actually, we made this along with her in response to a request from an external organisation for something on redundancy a couple of months ago now. Now, that area is fraught with legalities and technicalities, and we decided we weren't the best people to address it. But it was in that sort of environment that we thought maybe we should write something about, in an atmosphere filled with worry and uncertainty, what are some helpful ways to communicate? So I'd like to just run through what Katie advised right now. Establishing clear communication patterns. When you're going through periods of change, people you manage need to know what they can depend on. So setting some helpful routines about when and how you'll be in touch and checking whether those routines are useful. And related to that is maintaining regular touch points. It can be particularly easy for people to withdraw, either when they are feeling pressurized or when we're all working remotely. And so having a regular thing in the diary that doesn't depend on anybody saying they need it, is just in the diary, is a really useful principle to try to stick to. Create a culture where it's okay to talk about personal things, because periods of change affect people in very different ways. We don't really know how anyone's feeling on a given day, so it needs to be okay to ask each other how you're doing and really want to hear the answer. And as a line manager, showing that you're struggling too is okay. You can be vulnerable. It helps to create a culture of openness. Encourage other connections with people outside of the team. This is one that you might not have thought about very much, but it's worth doing. And in fact, for many organizations at the moment, it's easier now than it ever was in the past, because if everyone's working remotely, getting in touch with someone from a different department or site is exactly the same as speaking to somebody who previously sat next to you. And finally, if those difficult conversations are on the horizon, if there's something tricky to negotiate or to kind of break some news, first of all, it's really worth preparing in advance. Think about how you're going to hold the conversation, get advice from HR colleagues or peers, and think in particular about how it will come across to that person that you're approaching. Everybody responds differently. How have they responded to things in the past? What might be helpful for them? And that, in turn, that conversation itself isn't the end of it. If we're going into something difficult, that should always just be one part of a larger process. There should be avenues for feedback straight away. Channels of conversation should be kept open. Another set of advice from a different expert relates much more directly to what's going on right now, the pandemic. So we produced this. I'd like to turn to some of the feelings and issues around it, really. And this is a section that is going to lean heavily on the views and advice from the people behind this Igloo framework that we looked at earlier. So it was earlier in the summer we produced this toolkit page on transitioning back to work after lockdown. And that was at the time when it looked as though this was the way the whole country was going. But actually it applies to periods of transition generally, and we certainly have a constant stream of those at the moment. So I'll go through the main points that Dr. Yarker suggested, but first I wanted to tell you really why I think it's worth you remembering this in the coming months. Essentially, it's worth thinking of the weeks we're in and the months ahead as something a little bit like returning to work following a period of mental illness. And I'll tell you why. It comes down to this. Everyone's situation has been different but pressurized this year. There are those who have been ill or caring for those who are, those who have lost loved ones, those with childcare or homeschooling responsibilities, people who don't have childcare or homeschooling and have felt more overlooked than usual by the narratives about family life, those who've spent the summer helping out a neighbour or worrying about whether someone has food, those who were shielding and are still counted as clinically extremely vulnerable, but all the extra support has gone away. Those who think they should feel grateful not to be so vulnerable, but actually have been really miserable. And that's before we even think about all the different work predicaments. There are people who can't name any of the above examples that apply to them, but have rightly found it a long and stressful time, but they feel they shouldn't feel that way. People whose jobs have already been lost or are currently at risk, people whose work is secure but are losing colleagues or clients. The point is, everybody has had extra worries, and everyone feels as though they've had fewer worries than somebody else, but that just makes it more emotionally difficult. There's a huge aspect of survivor guilt mixed in with all of this. And now everyone's transitioning to new situations, whether it's contemplating going into workplaces, contemplating meeting clients, or doing neither of those things while others start to do so. Whether it's thinking about the fact that the rules might suddenly change again tomorrow or next week or next month, contemplating losing all or part of their own job or their workplace changing around them. The point is that all of our resources are depleted and we are all starting to ponder a next stage without knowing what that next stage will feel like. And for that reason, we should all of us approach this in a similar way to returning to work following a period of mental ill health. And the advice that Joe gave us in this respect is quite simple, really. First of all, talk and connect. As I said, everybody has had different experiences. If you're working alongside others, share those, because knowing what it's been like for each other better enables you to support one another in the future. Plan and prepare for each new stage. Think in advance about what will be different. It might be the physical environment, or it might be just in interactions with others, perhaps because of their own pressures or staffing changes. Think about how will your staff get there, either physically or digitally, as the case may be. What will be different? What will you or they need to do things differently? At each new stage of change, consider a return to work conversation. Establish expectations, raise concerns in both directions. Monitor and review how you and they are getting on. How are we coping, and could we be doing more to stay mentally healthy and to help each other too? And finally, just take it one step at a time. Don't expect things to get back to normal all at once. Life will keep changing anyway, but take care of yourselves. If we look at these list of points here, you can see why clearly that's a recommended framework for somebody returning to work following illness. But I hope I've made the case that it's a recommended way of thinking about all of our interactions at the moment. So finally, for this section, I wanted just to mention briefly occupational health and EAPs. This is something that Kristie certainly knows more about, our guest who is coming up later. But from a few points that I got from Jan Golding of Roots HR and also from Kristie from Unum, I wanted just to run through them. First of all, though, it's worth emphasising that these aren't the same thing. They're often talked about in the same breath, as I've just done here, but they have fundamentally different purposes. So your decisions in choosing them should be based on different factors. Engaging with an occupational health service can feel difficult to employees. They might worry that it might have implications for their status, their salary, their position. And that's why it's important to see occupational health as a tool for managers and planners and organisations, and to pick a service properly that fits what they need it to do. But at the same time as that, provide a confidential employee assistance programme as a benefit for employees. They're different pieces of the puzzle, but they both have value. Now, occupational health in particular has had an evolving role. Historically, it's been quite reactive, but now it's a lot more about becoming engaged early on. The face of it is changing. So that probably makes it even more relevant. Think of occupational health as an ongoing partner that can help make decisions and respond appropriately. So, and choosing the right one really can help to make sure that staff are properly supported to be in work, including during or after periods when they've been unwell. On the other side, employee assistance programs. Now, they provide confidential support for employees on a range of issues, both workplace and personal. And I'm told they can cost as little as £100 to £200 a year. Now, that's not per employee, that's per program. It took me by surprise when I first heard those figures. So choosing one can be a really worth doing, but more fundamentally, after that, make sure people really know that it's an option. So in a webinar last week, we had Jacqueline in the chat who works for an EAP, and she would hear responses from directors saying, we already have an EAP, thank you, we're sorted. And that came from a senior HR director whose employees weren't even aware of the EAP's existence. It's really important to promote it. And it's worth getting people used to the idea of using one for less stigmatized reasons. They can advise on, nutrition, legal advice, whatever it might be. It lowers the perceived barrier of entry. And then people might be more likely to go on using them as a step one in the future when things might otherwise have escalated. And that links directly back to what we've been saying in the first place about the importance of low-level, low-stigma support in place all the time. Next, on to tools, and now really I can't go any longer without telling you some more details about mental health at work. Actually, this is a way into any of the subjects we've been talking about so far, but I've lumped it into the tool section because it's a tool in itself. So we're a collection of resources and ideas from right across industry, all sorts of providers. But we don't just list them, everything is described and categorized by us, so that the idea is you never feel as though you're just going through a load of search engine results or marketing materials. They're presented in different ways to help you try to look through things that you would never see collected in the same place otherwise and figure out whether any of them might be helpful to what you're trying to do. We help you to find them in all sorts of ways. So you might use our tool on this front page here to narrow down who you are and what you're trying to do. Or you might be reading one of our toolkits. So I'll go back to this previous example. It was actually followed by a whole set of recommended resources. This is how they work. So you get a bit of an introduction to a topic, and then underneath a whole set of suggestions by us or by our guest expert about what we think you might find useful. Or finally, even if it wasn't through one of these supposed toolkit articles, basically anytime you see anything written on our site, guest blogs and articles, they will always be filled with links to resources you can use. Just tell you a little bit about two key things we're trying to achieve at the moment on the site. First of all, to try and widen the range of viewpoints, really. This mainly relates to our realization earlier this year that our whole industry has never really made enough effort to be genuinely inclusive in who it appeals to. And mental health at work is no exception to that. So we've been trying to challenge bias and widen representation on our site, and generally expand the range of issues, people, and types of activity that spring to mind when you think of work or mental health. It's not a coincidence that I chose a frontline Yorkshire postal worker rather than a senior leader or HR expert as my key guest today. Now, if that seems a bit like jumping on a bandwagon or following trends, or maybe just less related to this webinar or the pandemic climate, it's worth considering that more marginalised groups are also the ones likely to suffer the most during pandemic or lockdown. So it relates to the aspect of the standard that Faye mentioned about providing targeted support to particular groups and issues. On that note, though, if there is a topic you would like us to look into, we are always happy to do that. We have a qualified journalist on our staff, and we do this by getting in touch with experts to advise us from anywhere. So if there is a subject you'd be interested in, my appeal to you is to tell me in a message to me in the chat here. Don't put it in the main chat window because we're saving that for questions for everybody. But if you write it in a private message to me, I'll find it in the transcript later, and we'll see what we can do. We may, of course, end up coming back to one of you for the guest expertise, but do feel free. The other thing we're trying to do is to aggressively lower stigma. So we have talked a lot about trying to make this seem like a low-level, easy, accessible subject. And one of the ways we're trying to do that is to make sure that as well as addressing difficult topics, our site makes you smile. So I thought I would show you a really small bit of a video that we put out for World Mental Health Day this year.
Hello. Hi everybody. Hello. Hi.
Hello.
I'm Beckett Frith.
My name's Faye McGuinness.
My name's Sabrina Bramble.
I'm Ewan.
My name is Sophie. And I work on mental health at work.
I'm a freelance writer for Mind.
I'm the head of workplace wellbeing programmes at Mind.
I'm the manager of the Mental Health at Work site.
The senior content officer for mental health at work.
One thing that I like to do for other people, particularly when times are quite tricky, is to get a bit...
Sorry, Sophie, I'm going to cut you off there. It's a great video, though. Do find the rest of it. So on that note, we're actually planning another message of hope for the middle of winter. We thought, given how terrible the year has been, we might try and collect from a wide range of people, 5 or 10 second little snippet of a message of hope, a piece of advice, something you've learned for the year, something you're looking forward to. And we'd like a really wide range of people and thoughts. So once again, if you fancy being one of those people, send me a message in the chat. If you can put your email address and something about you, who you are, or where in the country you are, what you think, what you're doing. I'll collect them up later and we might be in touch. So finally then, for my last few minutes before we open up the questions, a few particular other tools that we would recommend, and this one has been mentioned a few times over the last week or two, wellness action plans. Now, this isn't a Mind initiative, but Mind really recommends them and produces some great guides to how to do them. A wellness action plan is essentially a way of listing in advance, not necessarily during any crisis, listing the things that help to keep you well, the things that you might find difficult, the things colleagues and managers can do to support you, how they might notice if you're struggling, and what might help if you are. So these guides to wellness action plans from Mind, they include all sorts of information about what a wellness action plan might include, what it might cover. And then in the end, they're really easy to fill in a few questions. Here's an example. Are there any situations at work that can trigger poor mental health for you? What might your manager do to proactively support you? Now, the idea of these is that everybody does them. They don't say anything about whether you yourself have a mental health worry in any respect. And so it really takes a lot of the stigma away from it. Asking someone to complete it is no reflection of them, it's a reflection of your whole organisation. Now, it's not an end in itself, of course, but it's a way of starting a conversation. It's an easy way. I spoke to Aaron, one of our writers who works on these, and he said, well, the worst part for people is often sitting down. How do I even begin to have the conversation? And this is a sort of a gateway to get you through that. As I said, it's also a destigmatizing signal for the whole organization. And once you have these filled in, reviewing them regularly is an opportunity to check in on all those issues, again, without it needing to be a response to a crisis. Now, Mind has produced an updated version for the current situation of working from home. It's become a little bit more of a self-reflection tool as well as a managerial one. It invites you to think about your household, about yourself, about what's around you. And it has scenarios to consider. How do you usually do this and how have you adapted to it now? I know that that's something Kristie, our next guest, has some experience in using these. We might ask her to talk a bit more. A couple of other tools that we have linked to from Mental Health at Work. This is your Mind plan from Public Health England's Every Mind Matters campaign. And all it asks you to do is answer 5 questions to get some top tips and advice to help you look after yourself. Here's an example of one of the questions. It's incredibly simple, quick and easy, is completely free and private. And at the end, it gives you a load of suggestions. And if you don't like any of them, you can swap them for others. I'm really a fan of it. Finally, a couple of free training courses. Yesterday, we talked about paid, more bespoke, more in-depth training. But it's also worth remembering there are some free ones out and about, and they can be seen more as a sort of confidence booster for staff rather than a detailed dive in. But 2 of them in particular that have been well received. One of them is from the Zero Suicide Alliance. This is a 20-minute course in the importance of not being scared to mention suicide with somebody who you think might be feeling low. I won't cover the content of it now, but it's been recommended to us by quite a lot of people. I think it's great, and you don't have to sign up. You don't have to create an account. You just go to their website, go through it for 20 minutes. It's really powerful. A slightly more in-depth one, and this was mentioned by This Is Me the other day. This is Wellbeing in the Workplace. It's, I think, a couple of hours long. It's from the Lord Mayor's Appeal and the Samaritans. You do have to sign up for an account with this, but that's because it's a couple of hours long, so you can come back and fund your progress. But it's a really good way of increasing organisational confidence to enable people to have those conversations we keep mentioning. So those are the last of the tools. And before we go over to the questions, just 2 themes really that I wanted to come back to, and you probably won't be surprised at what they are. The first one, back to diversity, power and inclusion. I've included the word power there because, well, it isn't just about the standard categories you might expect it to be. Providing a tool to support someone implicitly involves making a judgment about who they are. So it's worth remembering to bear in mind issues of what's going on in their life, what needs might they have, what situation are they in that might be being a little bit overlooked by the mainstream. We've got quite a few things on our site to help you and other colleagues think about particularly vulnerable groups, and we won't stop increasing those. I wanted to just show you 2 examples. This was our toolkit on being anti-racist in the workplace, published along with Mike, mine's Equality Improvement Manager. I'm extremely proud of this. Never would have pictured myself writing something like this not long ago. And another one is this article by Beckett on how employers are such a useful bridge to safety for those experiencing domestic abuse, and in particular, the relevance of that to lockdown times. I wanted to focus on those two things just to illustrate that it isn't only about the predictable diversity categories you might think it. There's a wider bit of thinking to do about whose stories might be being ignored, who might warrant some particular support. And in any case, the thing is, if it's clear that you are genuinely thinking about a person's own situation, then the tool or support you offer will be much more likely to be taken up. You can see it as a practical point, really. But that brings us to the final one, about employers needing to promote actively the use of these things rather than just handing them out. As we said at the beginning, really actively promoting these things, it's a really good way to create a culture in which the issues seem okay to talk about. But also, there's a bit of an underlying message, I think. If we can leave something on a desk, we can hand it, we could forward it by an email. But if actually we follow up, we get into a discussion, how did you find that? I thought the same, how did I find it? It really gives an important underlying message that is quite a relevant one at the moment, simply that we're all in it together. And at that point, obviously I can't hear because everyone's muted, but I'm just going to assume there's a rousing standing ovation from across the country. And so we'd like to introduce Kristie O'Donovan, who I've asked to join us for the questions. So she is a vocational rehabilitation and wellbeing consultant at Unum, who are specialists in employee health and benefits. And that means she works really closely with a wide variety of clients looking at wellbeing solutions that might help them. So it in turn means she gets quite a cross-sectional view of what people are doing out there. So I have a few questions to get things started, and glancing at the chat, I can see there have been some questions there. Ooh. So we'll hand over to Sophie in a moment. I can see you've been unmuted, Kristie.
I have been unmuted, yeah. Bit of a panic there, but I'm good to go.
Thank you. So, well, we'll jump into one question, because I know you mentioned this to me before. I know you've looked a lot at wellness action plans. Can you tell us how you've seen that working in practice and how successful they've been in organisations you've seen?
Yeah, absolutely. Really successful. So a wellness action plan is a benefit for both the employee but also the business itself. As you said, sort of that lower level entry at first, it can feel a little bit intrusive for some people, but it's really important for the line manager or for HR to really reassure that individual that the employee only needs to share what they're comfortable with, and just really highlighting that it is that collaborative, supportive tool. So I think what you spoke through earlier, that framework of the IGLU and ACAS's framework as well, sort of brings everyone together on the same page. A phrase that we often like to use actually is no decision about me without me. So through all the best intentions in the world, sometimes employers can make the assumption that they know what might be best for that individual, which in practice may not actually be the case. So essentially a wellness action plan really helps individuals to be seen as just that, to be seen as individual. And it really, as I said, helps to reassure that employee that they work for a business that cares for them, applying that sort of practical approach to addressing potential triggers in the workplace. But as you said, actually, it's quite a nice entry-level way to structure those conversations. A business that encourages sort of regular communication between a line manager and employee, so regular one-to-ones, making wellbeing part of that conversation, and a wellness action plan simply just provides a little bit more of a structure to them. However, sometimes what we do find is even in a business that completely supports a culture of openness, there's still always sometimes that feeling of maybe guilt or embarrassment from an employee to say, do you know what, I feel like I need to take the afternoon off, or actually I've had a really bad morning. And they almost have to, I'm going to say, ask in inverted commas to do that. Whereas when a wellness action plan is put in place, it really removes that pressure, that guilt of having to ask for that support. And actually, when I speak to employees, that's a real benefit of one of the main things that they say really helps. And that sort of reinforcing actually they work for a supportive employer. But not only that, they are really good. You mentioned presenteeism earlier on in the webinar, and sort of the huge cost on businesses, but obviously the impact that has as well. So They really help to address presenteeism, help to reduce sickness absence by being more proactive, helping employees be more productive, so essentially reducing that cost on businesses as well.
Well, thank you. That was a really wide-ranging look. It's so interesting, this idea that effectively that's an angle I didn't think to mention, that this notion that it's as though permission is granted in advance, so at the time when you need it, it's not in question.
No, absolutely.
Thank you. So another thing I wanted to ask you about before we pass over to Sophie and see what's come from elsewhere. A third of this standard is about targeted support for particular issues, and I've been trying to sort of draw parallels with diversity issues here, although that's not, of course, the whole subject. Can you recommend anything to think about when employers are considering how to support people whose needs might be overlooked? What helps?
Ultimately, it comes down to communication and really creating that culture of openness. So the ideal situation is having an environment where someone is able to come to work as their authentic self. So whether that's their gender, their race, their religion, their sexuality, and as I said, a big part of that is communication. And when you're having that communication with an employee, it's okay to be honest. It might not be something that you're familiar with yourself, or maybe that you understand yourself as a line manager or as an employer. Everyone has a different frame of reference, and that's okay. So it's really about actually asking the questions. What does that employee need from you? How can you support them? And sometimes just knowing that question is being asked is enough for them to feel more inclusive, and knowing that actually if they do need something, that support is there. Sense checks within the organisation are really good. So you mentioned kind of that targeted support. So pulse surveys, employee engagement surveys. How do your staff feel? Asking them, do they feel that they're able to be their authentic self? Do they feel that their mental health and well-being is supported? If not, what can you do to help that? So it really helps to kind of generate that discussion. And exactly as you said, that follow-up piece is so important. So it's not just that conversation, shut the door and it's done, but actually it's that following up, making sure that they're continually reminded that support is there, whether they need it or not, whether they want to engage with it or not. You're opening that door for them to be able to either engage. And as that Michael said earlier, actually that approachable style is so important, and it really can be what makes all the difference. Obviously EAP, so employee assistance programs, will also often have toolkits, resources, information for both line managers and employees on particular topics. So similar to you've got at Mental Health at Work, sort of toolkits around diversity, for example. So what do line managers need to be mindful of, and actually what support is there for employees as well.
So interesting there. One of the things you mentioned about just not being scared to ask, it seems to crop up so often in any area of life that is sort of a bit stigmatized, or that people are a little bit nervous about. I don't want to ask because I don't want to feel ignorant or insensitive. But
yeah, you don't want to say the wrong thing.
Yeah, but it seems to so often come back to, well, if you're doing it for the best reason, actually people are more understanding than you think and appreciate being consulted. And
you can just be honest about that. As I said, everyone's different, everyone's individual. So just being really open and honest about that, but saying despite me this not being my area of expertise, I still want to understand how I can support you, and where that support can come from, what we can do as a business.
Oh, thank you.
You're welcome.
So I was going to finish with a general thing about just any other examples you might provide, but of what you've seen, but you've covered so many things there. Maybe we'll first of all go over to see if Sophie has anything, and then we'll come back.
Perfect.
So there's just one question from me. We touched really briefly on choosing things like EAPs and occupational health, and also on the fundamental difference between them. You're the expert. What should people consider when they're looking into this?
It's just aimed at me, being the expert.
It
is. I think when we're thinking about this topic, you said kind of not grouping them together, but ultimately, instead of thinking as occupational health or an employee assistance program as something who is for someone who is unwell, usually the unwell proportion is actually a really small sort of percentage of the workforce. If you think about sort of a normal distribution bell curve, as it were, majority of your workforce is going to sit in that middle bit. So not really unwell, but not extremely healthy. So essentially, when you're thinking about choosing an occupational health or employee assistance programme, you want to think, what can we do to keep the staff in the middle? How do we keep the well staff well? So firstly, before actually choosing one, understanding key trends that you have in your business. So going back to that targeted support, it's really helpful to use the data that you've got. So sickness absence data, employee focus groups, risk assessments, employee engagement surveys, as we've just mentioned, and really not approaching it with that, well, we need one, so we're just going to tick a box. Actually, we want it to be targeted. And when you're really thinking about it, early intervention is such a huge part of that proactive prevention piece. And recent research actually, has found that it is much more cost effective to have proactive interventions than it is to have that reactive. So you get a much higher return on investment going for a proactive intervention rather than having that reactive approach. So as an example, we don't want occupational health to only be seen as that referral, like sort of last resort referral services for really complex long-term sickness absence, but instead, why can't we use them for early intervention referrals for health issues such as mental health, such as stress in the workplace? And it really helps to then make effective adjustments, put them in place early, prevent the risk of that problem escalating. And what businesses don't realise is there's just so much scope for HR professionals to make more valuable use of that expertise. So through training courses or working in partnership with their providers to get that real effective health and wellbeing strategy, whether that's rolling out line manager training or awareness sessions to employees. So just really understanding that full breadth and width and scope of taking off that reactive hat and putting on the preventative one.
Actually, I wonder if Faye might say something about that. A lot of what you've been saying there is quite reminiscent of the whole thriving at work agenda, which is sort of not so much about assuming that people are either well or they aren't, they're in work or they're not, but about supporting people to thrive, to do as well as they can.
Well, yeah, exactly. Yeah, no, absolutely.
Yeah, I mean, I think it really resonates with me what you're saying there, Kristie. I think for many years we have been speaking about health and safety, but in reality, what we've been speaking about is safety. Yeah. And I always use a simple example. You know, if you're in the office and there's a hole in the floor and you fall down it and break your leg, your employer will make sure that that hole is covered and nobody else falls down that hole, right? We've got that figured, we've got that sussed. So why are we not doing the same in terms of mental health? Why are we not approaching it by creating psychologically safe work environments where people don't continue to fall down those holes?
Yeah.
And I think you're right. So when you're thinking about actually occupational health and employee assistance programs, we are always thinking about people that are at the point where they need support for their mental health. But actually, what are we doing to look at occupational health and employee assistance in a preventative way? And actually, what can we do to actually make sure that we're supporting people wherever they are in the workplace?
Yeah.
And I think, you know, we talk about thriving at work. I think that at the moment, it's probably a big ask to ask people to be thriving at work, and that can look different for different people. But actually, everybody has the right to thrive at work. We should be really, that should be our vision. That should be our goal, right? Because I think what I've got from your presentation, Ewan, is that the brilliance of the Mental Health at Work website covering so many elements of what makes people human and what they bring to work is the fact that we aren't just employees, we're human beings and we bring our whole selves to work in some degree or not. And so although work might not be the driver for people with poor mental health sometimes, it is a place where we can feel safe and connected and like we have a place in the world. And so I think actually, you know, if you bring all of that together, we really need to think about how we create those psychologically safe work environments so that people can be the best of themselves. And I truly believe that we all have the right to feel like that.
Yep, no, absolutely. I agree.
Wow.
I think there is one more question in the chat, so we've got 3 more minutes, so we can probably take that question. It might be for you again, Kristie, I'm afraid. Oh. But it says, do employers have to take the advice of occupational health when dealing with employee mental health?
So, I mean, it depends what the reason that they have been referred in for. So essentially, occupational health, again, that sort of reactive approach is usually at sort of historically has been at a point when maybe an employer is concerned over someone's fitness to be at work, and they're providing that medical comment, in which case ultimately as a business you have that duty of care for your employee. Is it safe for them to be at work? And you have to make that decision based on that clinical information that you've got. However, the vision is that if we can intervene before that, then actually you won't be getting those medical comments from occupational health. So it won't be this person is fit or this person is not fit. It is actually way before that, and thinking about what you can be doing to prevent them getting to that point. So it depends what you're referring the person into occupational health for, essentially. But if it is that comment on whether someone's fit to be at work, because historically most of the time it has been, then it comes down to a business decision and whether you think that person is fit to be in the workplace or not. But yeah, hopefully there'll be less of those if people can sort of take more on board with this preventative approach.
Brilliant, thank you. And I completely agree. And I think it's just important to remind people that, you know, mental health does fall under the Equality Act. So people with mental health problems are protected under that act. So an organisation has a legal responsibility. But actually, you know, organisations more and more are knowing that this is the right thing to do. And so I think, you know, that's really important. But it's important to say that we are guided by the Equality Act in that sense.
Yeah, absolutely. But the law literally lays out sort of the minimum standard. So if you can go above that, then you're going to get a much more engaged and supported workforce from that as well.
Definitely. Right, so I think we've come to time. So I just want to say a massive thank you to Ewan and to Kristie. The purpose of these webinars are to really kind of pull out some kind of key information, practical hints and tips, and show people where they can get more information. And I think we can safely say that we've done that today, which is brilliant. So for those that have joined the rest of the series, you'll know that we are uploading these webinars onto the Mental Health at Work website for you to watch afterwards. We have one more in the series, so looking forward to that next week. But I will just finish by saying what I've said on every webinar, is that we need to be kind to ourselves, we need to be kind to each other. We're all in this together. Mind are here to support you. The Mental Health at Work team will continue to provide you with resources and support. So big thank you for joining. Have a lovely weekend, and I'll see some of you no doubt next week for the final webinar. Take care.
Thanks everyone.
Goodbye.
Bye.